We are delighted to discuss with MEP Andriukaitis the EPHI, Environment and Public Health Institute report on longevity from cure to care. We are delighted that we have today here in Strasbourg at the European Parliament, Mr. Andriukaitis. MEP Andriukaitis is not only a member of the Healthcare Committee, but he is on the forefront regarding longevity, silver economy and lifestyle.
Yes.
And I'm so pleased that we are here together today.
Thank you for inviting me.
Mr. Andriukaitis, how can the European Union incentivize a systemic shift from a treatment-based healthcare models toward prevention-based systems?
It's not only about European Union.
Yeah.
It's about member states, about our societies, about our educational system, and of our capacities to understand what does it mean healthy aging and possibilities to have healthy longevity. And I can tell you, why I am speaking about it. In Lithuania, we had excellent thinker and promoter of lifestyle, Vilius Vidūnas. He achieved 92 years old.
Wow.
And at that time, he feel himself as age of 30. One thing is biological age, another thing how you are feeling and what your parameters.
Yes, this is a great point, and I'm so happy that we can also talk about the key findings of our longevity report. What do you think? Why? Because in our longevity report we have also so little spending on preventive healthcare. For example, 3% only for preventive healthcare. Why do you think that is?
Because it is, old style paradigm. Old style paradigm is a wrong approach, but is rooted as a mythology in our modern society. And always we are, of course, it is very, a complicated issue when you are elected and people always attacking you. Look, we need to have pills, access, hospitals and so on, and it creates political domination. But if you are speaking about prevention,
yes,
about long-term strategies,
yes,
about possibilities to eliminate risk factors, about promote active lifestyle, about promote healthy habits, it's always not so interesting.
But what are concrete measures that the European Union could do?
My answer is very simple. Let's ask us how cost situation of inaction in prevention. Inaction in prevention.
What do you mean by that?
Inaction means if you are not doing nothing in possibilities to include prevention from kindergarten till aging society. If you are not ready to have possibilities to include in all sectors, preventative measures, so it should be included in every area. Starting from agriculture, finishing with education. Starting from our health sectors, finishing with our politicians. We need to understand now if we can discuss about necessity to change our paradigm, going off treatments, but going into promotion of healthy capacities. We have a lot of healthy resources in our body.
Yes.
In every individual has a lot of capacities.
Yeah, and we are also talking in our longevity report how important this shift, this mindset shift is. And you are also one of the MEPs who's saying, okay, we need to take universities, scientists, the pharma industry, public-private partnerships, all together and go on the road of preventive healthcare. Why is it so important to bring everybody together at one table?
Otherwise, it is impossible to fight different risk factors because you see a lot of obstacles in every field. It's multi-sectorial. It requires a multi-sectorial, very coordinated action plans in different fields. But of course also, please keeping in mind, if we will calculate calculate economic cost of inaction in prevention, you can see the burden of NCDs is going up. Possibilities to compensate treatment is impossible, and you see it's a dangerous crossroads of our capacities not to address NCD's burden, and we know very well that we can address it if we will stay 3 times more active on preventative measures.
What you just said about the burden, considering that up to 80% of healthcare burdens are linked to lifestyle-related diseases, how can European Union policy change?
First of all, we need to say very clearly, it is not only responsibility of individuals, it's not only responsibility for local authorities, it is the responsibility of member states, business organizations, and also European Union. I am very fine to promote to have pan-European prevention strategy, which can describe in very detailed manner, covering all sectors, and proposing instrument which should be included in different areas, reducing burden of NCDs and promoting much more effective tools which are not in hands of medicines, but in hands of other sectors.
I really loved the pan-European strategy towards preventive healthcare, and you also mentioned businesses. What do you think, what kind of positive effect public-private partnerships can have?
It is crucial. Public-private partnership can explain to society in much more easier way that public sectors requires a lot of public defending of financing of public goods. Private sectors is winner if private sector has a healthy labor force and healthy consumers and more active consumers. And you know how many different business areas you can develop in preventative activities. It is starting from wellness valleys, finishing with food reformulation and so on.
Yeah.
It means that public-private partnership in prevention is crucial. It can help absolutely to be more effective and to protecting European capacities to be global leader.
Great. I'm loving your energy, and I also would like to know, do you think in a future European Union preventive healthcare strategy that public-private partnerships and private businesses and private money should also be mentioned in the strategy?
Absolutely, because we need to understand healthy business. Let's create new wording.
Yes.
Healthy business.
Yes.
It means that the business requires a lot of efforts to have very excellent environment upon him.
Yeah.
And healthy environment can raise human index highest, and effectiveness and quality of
Yes.
healthcare workforce would be much higher, and effectiveness in production and so on, it would be much higher. We have figures in our hands. It's not without scientific assessment. We have scientific studies which can show that you keeping in mind human capital and keeping in mind possibilities to have very effective human capital, for businesses going up as much as possible.
And what could be concrete measures?
Concrete measures. It would be concrete measures would be described in all areas of our activities, especially starting with educational programs. Then developing our business organization to understand human capacities, human index, necessity to use. Third, we need to reshape our labor market. Silver economy and healthy long living standards can help to open new opportunities to very experienced labor force. Because labor force, which has a very good experience, you're introducing pension aging.
Yeah.
Sorry to say, but after you see a lot of very active people.
Yeah. And silver economy, what is it with one short sentence, if it's possible?
It is a never-ending excellent business.
Okay, Yes, for the one who don't know what silver economy is, it is an excellent business because it's focused on tourism, but tourism with a lifestyle, a healthy lifestyle approach where you have a diet, and this is oftentimes organized by private organizations.
Wellness Valley or Healthy Wellness Valley, they can unite a lot of business partners and develop new possibilities to big ecosystem where not only old understanding of Kurort, but a restoration of our health capacities. It is so important area of businesses, and private sector can do here a lot.
Great, thank you so much. I would like at the end shift to cardiovascular health, because many cardiovascular health diseases are lifestyle diseases, and also private companies are investing into diagnostics. What do you think about the cardiovascular health plan?
It is only one way that in such cardiovascular health plan we can introduce a lot of preventative instruments, starting with possibilities to organize DG platforms, DG devices, which can help us to assess our situation, to indicate if something will happen, to prevent something, shocks and so on. Of course, knowing very well that we need to understand how can we measure our parameters in more suitable way, blood pressure, pulse and so on. A lot of challenges we can be reduced if we can introduce as early as possible very detective instrument in cardiovascular plan.
Yeah, and should private companies also play a role in that?
First of all, it's up to private companies to understand it.
Yes.
Because they can play crucial role in this.
Yes.
And of course also if you can see, for example, your development of your health-work balance.
Yes.
It's up to private sector to understand that health-work balance is about their business success. It's not about, you work and then you go out and I'm not care about.
Yeah.
It's about your success to have very potential healthcare work.
Yeah, true, very, very true. And I would like also to know now to the last question that I have. We have also the upcoming tobacco directives, and regarding harm reduction, we are, for example, Stockholm-based. Sweden will be the first smoke-free country and is right now the first smoke-free country in the European Union percentage-wise. And one thing why that is working so well is because we have harm reduction products like nicotine products, like nicotine pouches and other alternative products. What do you think about harm reduction and the tobacco directives?
Absolutely. We need to think about necessity to introduce different methodologies to reduce harm of nicotine, and to see how can we help us. Of course, I am very happy that smoke-free areas now. You look in our canteens, in our cafes, in our bars, in our planes.
Yes.
Now you see a lot of spaces where smoke-free space.
Yeah.
It means that if you are promoting smoke-free, and of course if you are promoting possibilities to reduce dependency on nicotine and develop new different tools to reduce dependence of nicotine, it would be a very excellent opportunity to move forward in such direction.
So do you think that alternatives, nicotine alternatives that are not smoke nicotine alternatives like Swedish snus or nicotine pouches could be a healthier alternative than traditional smoking?
Frankly speaking, alternatives it should be implemented in a very careful way. And of course also it requires necessary monitoring from medical side, because
Yes.
because you know some area where it is very dangerous situation to also to see that snus can develop some diseases in your oral health. You know, it is also very sensitive issue, and of course replacement of some products which can help you to cease smoking. They also should be monitored at,
Yes.
at level, at scientific level and healthcare specialist level.
100%. I totally agree that they should be monitored, like they are monitored in Sweden right now. But do you think that nicotine products, like for example nicotine pouches or snus, that are not smoking, like not traditional cigarettes, that they are a more harm reduction alternative than traditional smoking?
Frankly speaking, we need to have evidence in our hands. It would be very difficult to say something about that it can, you know, it can help us to go out of active tobacco use. But of course, I know very well that in Sweden you have snus tradition. It is very, very Swedish one.
Yes.
And of course also I know that it is enshrined in Lisbon Treaty, in treaties, it is exception.
Yes.
They have no chance to improve something more because Swedish smooth is cultural, you know.
Yes, but not only cultural, but also on the scientific way less harmful than traditional.
Of course, less harmful.
Yes,
of course,
it is. So it is. Isn't it the right way to say if you smoke traditional that the taxes, okay, they are high, but that you don't put the same high taxes on traditional smoking, but lower taxes on alternatives like nicotine pouches?
But you know, it is also, it requires a very thorough assessment. Look today in those electronic cigarettes and so on.
Yes.
They create a lot of challenges. And now we need to find ways, and we need evidence in our hands. I am a big fan to see not only smoke-free Europe, but excluding tobacco as such, because tobacco came into Europe only in 15th century.
Yeah.
And smoking started in 17th, 18th century, very short period. It's not like alcohol culture.
Yeah.
Alcohol culture has 7,000 years.
Yes, true. But couldn't the smoke-free be the first step and say, okay, if we have products that are less harmful, that they don't have to impose?
To see possibilities. How can you choose? Some is very risky and less risky. Between those, of course, it is a possibility to choose less risky.
The less risky,
This
yes.
possibility exists, but less risky.
Yes. Still harmful.
Still harm.
Yes, I completely agree. But then the less risky, that this has lower taxes than
it's up to governments
Yes.
to this. Taxation is always a very tricky issue.
Yes, true.
Because they excise duties.
Yeah.
It's jungles.
Yeah.
Jungles. Keep in mind. But of course, we need to say that if it's less harmful,
Yes.
it means less taxation.
Less harmful, less taxation. Thank you so much. And I just would like to end, before our interview, we had also a quick chat about how you stay healthy. And you said a very interesting word, and the love to life. And I really love your passion, and I'm happy that we could discuss the findings of our EPHI report about preventive healthcare with you, and wish you the best.
Thank you so much.
Thank you so much.
Thank you.